Albinism is a genetic condition where people are born without the usual pigment or color in their bodies. Causes: genetic mutations that affect the production of a pigment called melanin. There is a cell called the melanocyte that is responsible for giving skin, hair, and eyes pigmentation. So, what causes albinism? It causes when a defect in one of several genes that produce or distribute melanin causes albinism. The defect may result in the absence of melanin production or a reduced amount of melanin production. The defective genes passes down from both parents to the child and leads to albinism. Signs and symptoms. One of its symptoms is the absence of color in the hair, skin, or eyes. So, it means that the color of your hair, skin, or eyes is lighter than its normal color. Albinism can occur also with vision problems, which may include strabismus or crossed eyes, photophobia or sensitivity to light, nystagmus or involuntary rapid eye movements, impaired vision or blindness, and also astigmatism. So, what are the types of albinism? Number 1 is oculocutaneous albinism or OCA. OCA affects the skin, hair, and eyes, and there are several subtypes of OCA. Number 1 is OCA1 is due to a defect in the tyrosinase enzyme. Number 2 is OCA2. OCA2 is less severe than OCA1. It's due to a defect in the OCA2 gene that results in reduced melanin production. Number 3 is OCA3. OCA3 is a defect in the TYRP1 gene. It usually affects people with dark skin, particularly Black South Africans. Number 4 is OCA4. It's due to a defect in the SLC4582 protein. Another type of albinism is ocular albinism. Ocular albinism is the result of a gene mutation on the X chromosome and occurs almost exclusively in males. Another one is Hermansky-Pudlak syndrome. This syndrome is a rare form of albinism that's due to a defect in one of 8 genes. It produces symptoms similar to OCA. The syndrome occurs with lung, bowel, and bleeding disorders. Another one is Chidiac-Higashi syndrome. It's another rare form of albinism that's the result of a defect in the LYST gene. It produces symptoms similar to OCA but may not affect all areas of skin. And the last type of albinism is the Griscelli syndrome. Griscelli syndrome is an extremely rare genetic disorder. It's due to a defect in one of 3 genes. There only have been 60 known cases of this syndrome worldwide since 1978. It occurs with albinism but may not affect the entire body. Immune problems and neurological problems. Griscelli syndrome usually results in death within the first decade of life. So, what are the treatments for albinism? As of the moment, there is no cure for albinism. However, treatment can relieve symptoms and prevent sun damage. Treatment may include sunglasses to protect the eyes from the sun's ultraviolet or UV rays, protective clothing, and sunscreen to protect the skin from UV rays. Also, prescription eyeglasses to correct vision problems. And the last but not the least, the surgery on the muscles of the eyes to correct abnormal eye movement. Overall, an estimated 1 in 20,000 individuals are born with oculocutaneous albinism around the world. The disease affects people in many ethnic groups and geographical regions. The most prevalent forms of these conditions are types 1 and 2. Types 3 and 4 are less common to the world.